So now we will talk about how would you increase your memory regarding the MCQs. How would you retain the MCQs in your brain for a very long time? So there is a special term for that is called picturization or photographic memory. So that means if you turn, as there is a famous saying, picture says or picture means a lot. So actually that means if you remember one picture, so it means you remember 100 to 1000 MCQs. 100 to 1000 MCQs. So you convert the words into picture, and if you retain that picture, so you retain a lot of MCQs. So I'm giving you example, like for example there is MCQ if a person is lying straight, lying in supine position, where does the foreign body goes uh, into the, that is of course into the superior segment of right upper lobe. So what you do, you make a person in your mind that is lying flat. You make a person lying flat. Then what you do, you take out his lungs. Suppose this is his right lung, and you divide it into three parts: upper lobe, middle lobe, and lower lobe. So, and you take this portion out, superior segment of right lower lobe. So in this supine position, if you memorize this thing and you take this out in your mind, and you further take this out, and you say this is a superior segment of right lower lobe, so you would not forget this one. And in sitting position, most common site is the posterobasal segment of right lower lobe. Now how do I remember? Now take this one and make a picture in your mind that a person is sitting. Again, take the lung and divide it into three portions. The right lung has three lobes: upper, middle, and lower. So what you do, that it is the posterobasal segment of right lower lobe. So this is the right lower lobe, and this is the posterobasal segment. This one, take it out. This is the posterobasal segment of the right lower lobe. Similarly, you make a picture in your mind, a person is on the right side position. Where does now it will go? It will go to the posterior segment of right upper lobe. So again you make a lung, and this is a posterior segment of right upper lobe. And in the left sided position, this will go into the inferior lingular segment. So this is your lingula. So this will go into the inferior lingular segment. So if you memorize the things like this, you won't forget it. So if there are other MCQs, like a person drink water, a person sweats, he loses about 2 liters of water, and then the person takes 2 liters of water. What will happen? So I have already made a video on this. So if you remember that video in my previous lectures, and take the photographs of that in your mind, you won't forget that. So the first answer will be increase ISF volume. If that is not an answer, next is decrease ISF osmolarity. If that is not an option, then the increase ECF volume. If that is not an option, decrease ECF osmolarity. So now how would you remember this? Photographs. Now what if MCQ cannot be converted into the photograph? The second best thing is to repetition and writing. You write it so that it goes into subconscious mind. So writing the things which you do not remember and which are supposed to be ritualized. If you write a thing which are supposed to be ritualized, so that goes into the subconscious mind. If that goes into the subconscious mind, then you won't forget.